If you had to choose between debt or death, what would you choose? This is a very real decision a lot of Americans have to face. America is the only high-income country that does not have a single-payer, universal, or government-funded healthcare system, and we need a serious healthcare reform. Single-payer healthcare has been proposed numerous times in America. It has been an especially big point recently in Bernie Sanders' presidential campaign. Obama passed the Patient Protection and Affordable Care Act during his presidency. This act, abbreviated as the PPAC, has faced a lot of opposition, and for really no good reason. According to multiple Congressional Budget Office reports, this act actually reduced the budget deficit by $143 billion. So why was it opposed? The PPAC added an additional tax rate of 0.9% to anybody earning over $200,000 a year. It also, similar legislation also added a tax of 3.8% to unearned income, like investments. People oppose taxes a lot, and PPAC really only affects uninsured or underinsured individuals and people making over $200,000 a year. This map is healthcare systems around the world. Green is countries with free universal healthcare. Blue is countries with free but not universal healthcare, and red is countries with neither free nor universal healthcare. As you can see, it's mainly red is America and a lot of third world countries, which is a strange pattern. The reasons we don't have it are very convoluted and very partisan. And the number one reason is people think socialism is bad, but we're already a socialist country. The U.S. spent just under $2 trillion on social programs in 2018, as you can see by Social Security, Medicare, and Medicaid. And Bernie Sanders' Medicare for All program has had numerous estimates on its 10-year cost, ranging from $13.8 trillion to $36 trillion. Both ends of that estimate are biased, with the lower end coming from Bernie Sanders' campaign and the higher end coming from groups funded by conservative think tanks. But the important thing is both ends of the estimate show that it's actually cheaper and saves Americans a lot of money. This is from a paper about how much single-payer healthcare costs, and out of 22 proposed plans, 19 of them had a net savings for Americans. So we would save money in the long run. According to the Center of Medicare and Medicaid Services, a government agency, projected national health expenditures over the next 10 years are $47 trillion, which, if you compare that to $36 trillion, it's a lot more. It is a lot for single-payer healthcare. But how's the government going to pay for that, you ask? Taxes. As much as everybody hates taxes, they are essential. In 2018, $3.6 trillion was spent on healthcare in the U.S. That's 17.7% of the GDP. It's like $11,000 per person. And Bernie's proposed Medicare for All program taxes 4% on any household income greater than $29,000, meaning that basically it's cheaper at every price point, unless you're really rich, for single-payer healthcare under Bernie's plan. But this tax will not cover everything. It only covers like $4 trillion of it, which is where more taxes come in. And Bernie's proposed other taxes, like a 7.5% payroll tax for employers to pay, which still works out to be cheaper than what a lot of employers are currently paying. For insurance for a family of four, which was $12,000, and under Bernie's plan it would average about like $3,000, so $9,000 cheaper. Another possibility is extending the tax bracket, which currently covers only up to 518,000. So if you're making above 518,000, you pay the same tax rate from there to infinite amount of money. Whereas if we added more tax brackets, you could go to like 60% on people earning a shit ton of money. So they don't need that much money, right? If you don't know how marginal tax brackets work, you should probably look that up. It's actually really interesting. And yeah, why does this matter so much? 137 million Americans have medical financial hardships. That's 56% of adults. 62% of bankruptcies are due to medical debt. Imagine living in a country where going to the hospital could put you in lifelong debt. But for some reason it's okay because wait times are supposedly quicker, even though the United States does not record that data like other countries do. Overall, single-payer healthcare actually saves Americans a lot of money, even according to the most conservative estimates. The United States is very backwards in our healthcare system, and I think it's time we need to change that. Just, remember to vote in November. Youths are very underrepresented in our voting, and we should change.